Good afternoon and welcome to this session dedicated to the alcohol policy challenges at the international level. We're sorry we're beginning a little bit late, but it's because of the success of this session. We had too many people, we had to add some extra chairs, which is good news. So sorry for the little delay. I am Viet Nguyen Tan. I'm the head of the addiction unit in the Health Promotion and Prevention Division, and I will have the great honor and pleasure to co-chair, to co-moderate this session, along with Professor Michael Nassila, President of the French Society on Alcoholology. Thank you, Michael. As chairperson, I would like to thank those who worked very hard to organize this session in the addiction unit, in particular Jennifer Davis, who spent a lot of energy on these last months, but also our colleagues from DIRCOM and our loyal partner from Formule Magic for this organization. I would like also to thank in advance our great speakers who will share their knowledge, their experiences on the challenges of setting ambitious alcohol policies in Europe. Thanks to them, we will identify the difficulties that we face, but we will also, I hope, identify some solutions, not only about what has to be done, but also how it has to be done, how can we implement efficient policies. Our session will take place in two parts. In the first part that I will moderate, we'll have the opportunity to explore the burden of alcohol in Europe, but also examples of successful or promising policy initiatives in Europe. In the second part, Michael will chair this part. We will discuss the challenges of dealing with powerful economic interests when trying to put health promotion and alcohol prevention at the agenda. At the end of this session, we will have the opportunity to benefit from a few words of conclusion by François Bec, who is the director of the Health Promotion and Prevention Division at Santé Publique France. That's it for the menu now, and I propose we start this session. And first, we will welcome Florence Bertelletti, Secretary General of Eurocare, and she will explain to us what is the way forward for alcohol policy actions in Europe. Florence, please. I think you have to come to the...
I do. Okay. Thank you ever so much. Thank you to Santé Publique France and definitely to Jennifer for organizing this great, amazing meeting. Wow, look at all of you. This is exciting. All these people fighting against the alcohol industry and moving forward against alcohol-related harm. So what is the way forward? If I could have... Oh, no, it's me who's supposed to do this. Great. So I have some questions for you. As you can see here, you see a bottle of wine. And there are two cues, but one which is interesting that you see at the bottom. What you see at the bottom is actually my name. So this bottle comes from where my grandfather grew up in the northern of Italy, but it basically, I've got a long tradition, as you can see, with alcohol labeling. But more important, what I want to say is that I have no conflict of interest with the alcohol industry. I was reading a report yesterday showing that 70% of research on food, 70% is funded by food industry. And I wonder how much of the research on alcohol is funded directly by the alcohol industry. Beware. I don't have any conflict of interest. I'll zip this just very quickly to let you know that Eurocare, so it stands for the European Alcohol Policy Alliance, is a large organization working at EU level, influencing the EU institutions and also facilitating the discussions between our members. Our key message is alcohol, less is better. So what is alcohol? Can anyone in the room tell me what this painting is? Bacchus, yes. And who's the painter? And what do you see? So I know I don't have a lot of time, But it is Caravaggio. And yes, we hear time and time again that alcohol is part of our culture, it's part of our tradition, it's part of our heritage. Can anyone tell me what that painting is and what it represents? Well, if you don't know, it's also Caravaggio. It's the same model. It was painted few years after Bacchus. And as you can see, that Bacchus is suffering, probably with a liver disease. And so alcohol-related harm has also been part of our culture, our heritage, and our tradition for many, many centuries. Nothing is new. This is another way of thinking about alcohol. This is the little molecule. It looks like a little dog, and it's present in wine. It's present in beer. It's present in spirits in exactly the same way. And it will stick into your mind, I think, because I wonder, as it looks like a little dog, if it's the little dog who's taking us on a leash, or if it is us who's taking the little dog on a leash. I'm not going to go into what is alcohol, because I think there's a lot of specialists in the room, so I will skip that one. But basically, it's a substance that goes through your body and through your stomach, and it is psychoactive drug and with dependence-producing properties. What is alcohol-related harm? I'm going to go skip all these because I have only 20 minutes. The only thing that I want you to remember, and it will stick to you, alcohol kills a concert hall every day, or 2 people, including young people, every minute. It kills, just like tobacco. So it causes cancer, many different types of cancer, even at every low doses. The more you drink, the risk increases. I'm just going to go very quickly on all this. It also, there is a massive, massive impact of alcohol, second-hand harm of alcohol. The harm is not only to the user, the one who drinks, but also on the others. And this is a study which shows that alcohol is the drug which causes the most damage to second-hand, to not the users, but the others. And what is the situation in Europe? I've already told you, it's dire. And also 8 out of the 10 countries in Europe have got the highest consumption in the world. Alcohol awareness is very low. The public doesn't know about the harm of alcohol, and we can do something about it. And so what could be done about it? How am I doing with time?
You're doing good.
I'm doing good. Well, now I'm going into the part because I'm an advocate, and we need to influence policies. And so what we need to do is to regulate the environment, regulate the supply and the demand of alcohol, or as I like to call it, the 4 Ps. So the 4 Ps is we need to regulate the product, we need to regulate the price, we need to regulate the promotion, and we need to regulate the places. We've known what to do for many, many years. The policies that work are the same as with tobacco control, and the alcohol industry knows this. And I believe that targeting solutions at the individual doesn't work. We've been trying, you've been trying, we've all been trying for a long time to target the individual. That's not enough. We really have to change the environment in which we are so that the people can then make the right choices. The 4 Ps have been really taken into account. There was a very, very important policy which was adopted at European level by all the countries, and it's called the WHO European Framework for Action on Alcohol. It's a guide for all countries to actually do the right thing. It was negotiated for 3 years, and it has different elements. So take that document. It needs to be implemented with various action, and the deadline is 2025, so we don't have a long time to go. What does that document says? What are the best evidence-based policies? Price, ban on marketing, total ban on marketing is the best. Community actions, bottom-up actions, including involving young people. I can't remember what this one is. Oh, availability, restricting the availability of alcohol. And here I want to underline that we've got the best system in the Nordic countries, which are actually the monopolies, which I think should be mentioned all the time because they need to be defended. Here are strengthening health services, helping people with lived experience. And last but not least, it's health promotion with a special emphasis on labeling. And this is where I'm going to go. Labeling is something that needs to happen at EU level, as well as national level, but it would really help if it happened at European level. So here you can't see very well, but basically the EU was supposed to introduce mandatory labeling on alcohol by 2022, or to make a proposal that would be discussed between the Council and the Parliament. Nothing has happened. Also, they had promised to do a proposal on graphic warnings. Nothing has happened. So we are waiting and we are lobbying to make sure that actually this promise of the Beating Cancer Plan will take place. As the topic is labeling, some of you in the room know the answer, but can you guess which countries have health warnings on labels in the EU? Anybody? Do you know how many countries? Dorota is laughing as she knows. Well, there aren't many. There's only 4 countries, and some of these countries actually not yet, they have not yet put the label on the bottle. So it's Lithuania, France, Germany, and Ireland. One of the things that needs to be marked into history is that Ireland is the first country in the world to introduce a graphic warning, and also on the warning showing that there is a link between alcohol and cancer. Are these warnings in these 4 countries effective and big enough? The answer is no, they're too small and they need to be a lot bigger. And these are the kind of things that we want to see. This is the labeling and the warning that will be seen in Ireland, and that will begin to inform the public about the harm of alcohol. Another little cue, this I'm going to go whiz very quickly, but I used to work in tobacco control, and there is this perception, this belief that it was easy and it went fast with tobacco warnings and health warnings, and this is not true. So the first warning happened in 2001 in Canada, but by 2014 there were only very, very few EU countries that had introduced a graphic warning. And we tend to forget that it was also a battle for tobacco, and I believe that because we won in tobacco, we will eventually win with alcohol. Now the room is proving that there is so much interest, and all together we will make it happen. I have no doubt we've got a long way to go, but this will happen also for alcohol. So in a nutshell, people have the right to know about the harm related to alcohol, and to empower consumers to make healthier decisions, the EU should definitely introduce mandatory labeling and also create a library of health warnings as they did with tobacco. And these pictures that you see here have been developed by Eurocare and its large group of experts. It took us about a year and a half. We produced more than 1,000 different kinds of pictures, and these are the kind of things that we would like to see eventually on alcoholic beverages. It looks a little bit like it's never going to happen, but it will happen, mark my word. It will take time, but in tobacco, it was the same. People could not possibly imagine that we would have a plain packet on tobacco, and we did it. And it will happen in the same way with alcohol. So I'm at the end. So what you see in shops usually, I mean, these are beers. I mean, the alcohol industries have this amazing capacity of developing these beautiful labels on the bottles as a way to market their brands and to market the product. And indeed, the promotion for centuries, images related to alcohol have been used as a promotional and marketing tool to increase the product's appeal, but also to decrease the interpretation of the harm of the product. And here you have a kind of design for the future of what we want alcoholic beverages to look like. You have the label at the back with the calories and the nutritional information. And at the front, you can see the graphic warning. So we do believe that the labeling and health warnings should be key components. It's not the solution of everything, but they should be key component of a comprehensive, integrated approach to alcohol policies that government can use very cheaply. It wouldn't cost them a penny, but it would go a long way to inform the public and ensure that it would also be a springboard for all the other policies that needs to happen. And I think that's going to be my last message. So I'm doing well with time. I want to also say that if we want to make progress, none of us should work or talk or lose their time with the alcohol industry. There is indeed a fundamental and irreconcilable conflict of interest between the interest of the alcohol industries and economic operators and public health policies. And we should remember this and not work with them and waste our time. So these are my last conclusions. People are not aware, all the survey shows, of alcohol-related harm. Alcohol labeling and health warning should be key components of the future of comprehensive strategies. Harmonized regulation of alcohol labeling at EU level may assist and should assist countries to implement further measures, such as Ireland. And last but not least, we need to have qualitative and experimental studies to look at the impact of health warnings on citizens to find out which ones are the best to go forward. There. Thank you.
Thank you, Florence. I think you can stay at the pupitre.
Oh, okay.
Thank you for your energy, and thank you for this presentation, which shows that the European level can represent an opportunity in terms of alcohol policy as well. We have a few minutes for maybe 1-2 questions. If you have some, if you ask a question, please can you introduce yourself, tell us who you are before you ask your question. And let's go. The floor is yours for the audience. Yes. Yeah, at the back over there. You can ask, I think, in French or English, as you prefer, because we have a translation.
Et je
Do
parle
you hear
français.
me? Well, I'm going to ask in English. My name is Carolina Verli, and I am professor of consumer psychology at Grenoble École de Management in France. And I really enjoyed your talk. Thank you very much. I worked with the European Union in a literature review about alcohol labeling. And my impression is that despite the recommendations from the literature, the idea of QR codes or providing nutritional information through something that consumers have to scan to have access to the information is still being considered. So I would like to know your opinion about it, and how do you think it's going to impact or not consumers? Thank you.
Well, thank you very much for this great question. In fact, indeed, QR code is the solution that the industry is pushing. During the consultation, there was 3,000 responses, and so it was very divided. On one side, academia, NGOs, consumer organizations say, we want the label on the bottle, And then on the other side, only the industry. They recognize, because there's been surveys after surveys after, 3/3 of the German population wants information and labeling. So the industry said, okay. We agree, we're going to give this information on a QR code. It's a joke. And the Joint Research Center, so during the evaluation, has made the surveys. It's not used. And the people don't want it. It also creates inequalities. Not everybody's got access to a phone. Sometimes and also to compare one product with another. And finally, no and low. So the exemption, and that will be to wrap up everything, if you go to any shop, the exemption is above 1.2%. So below 1.2%, they're already doing it, because by law they have to. So if you go and have a 0.2% or 3% bottle of wine, the information is there. They know how to do it, and it's on label. It's just that they don't want to be regulated, and they don't want people to know what's in the bottle. Another glass of sulfate, please? I hope that answers your question.
Thank you, Florence. I'll take another question from the chat here. I read it in French. I know you can speak French. Merci pour ce propos tellement important dans ce temps où les comportements de célébration, ce dimanche encore, nous montrent la force des industriels. N'y a-t-il pas à jouer encore plus sur la régulation de la publicité?
I respond in French or
in English, I think, for the audience.
So, la règlement de la publicité, basically,
or in French.
Well, I can do my own translation.
As you prefer.
It's the only way forward is a total ban on advertising. Alcohol is such a great drug that even if there was no advertising, it would advertise itself. So, no more advertising. It's as simple as this. Nowhere. And that doesn't mean to say that people would stop drinking, but they would start drinking less. And that's the solution.
Thank you very much, Florence. I'll be a bit frustrating with the questions because we are a little bit late, sorry, but we'll have some time if you need to ask questions to our speakers after the session. There is the cocktail at 5 o'clock, so we'll have the opportunity to discuss more. And now, if Michele, you're okay with that, I think we're going to go to our second presentation with Michele Cecchini, who is the head of the Public Health Division at the OECD, and who will present us with alcohol prevention policies, those who work and those who are cost-effective.
Hello, everyone. Bonjour à tous et toutes. It's a pleasure to be here, and I would like I would like to start by thanking Santé Publique France for this invitation, this opportunity to contribute to the debate this afternoon. In the next few minutes, I'm going to tell you a little bit more about the work that OECD does to support better policies, better public health policies for better lives in the area of preventing harmful alcohol consumption. And I should also acknowledge that the work that I'm going to present is co-funded by the European Commission. So if we look at alcohol consumption across European countries, we see that there is great variability across countries in terms of alcohol consumption, but overall, during the last decade, trends remained stable across European countries, with an average consumption that stayed around almost 10 liters per capita. Clearly, as I said, there is a big variation across countries, ranging between 6 and almost 12 liters per capita, depending on the countries. So while the fact that there is a relatively stable trends over the last decade, it doesn't mean necessarily that is a good news. First, because in some countries there are very high level of consumption. Second, because there are also other very worrying trends that came out from our analysis. The first one is that about 20% of adults, 30% of men across European member states engage in heavy episodic drinking at least once in past 30 days. We're talking about almost 1/3 of men that have heavy episodic drinking, so very harmful pattern of alcohol consumption. The second one is that heavy drinkers consume the majority of alcohol across the countries for which we were able to measure the consumption, and it's between 1/3 and half of alcohol, despite they are a minority of the population when they reach very high level of consumption. The third one is that women, there is unfortunately an area in which women are catching up with men, and that's on level of harmful consumption. In particular, women with higher level of education are 13% more likely to engage in monthly binge drinking than women without a higher education across European countries. Finally, age of initiation of drinking is rising slowly, very slowly across European countries, but still 60% of teenagers aged 15 years age 15 drink alcohol, and 1 in 5 has experienced drunkenness across countries. So we are talking about 3 in 5 children that, according to the law of the countries, should have never touched alcohol, that were exposed and were initiated to alcohol, and 1 in 5 that had drunkenness across countries. And this is a tool that the speaker before me has already started mentioning. I go a little bit more in details based on some of our analysis. We calculated that life expectancy will be 1 year lower than it would be otherwise to the diseases caused by harmful alcohol use across European countries. Certain countries that have a higher level of alcohol consumption and more detrimental patterns have even higher impact on life expectancy, such as in the case of Lithuania, where life expectancy, according to our calculation, is decreased by almost 2 years of life. And one of the reasons why OECD looks at this issue is that it's not just a health problem, but it has also very economic consequences. We calculated that 2.6% of healthcare expenditure across EU member states is devoted to treating diseases, the consequence, cancer, cardiovascular diseases, and all the other diseases that are consequences of harmful patterns of alcohol consumption. This decreases labor force productivity. People that develop diseases, they are more likely to take sick leaves. In some cases, they retire earlier than they would retire if they didn't develop the disease, and they are less productive. And the impact is almost 2% of the GDP of countries. We are talking about a significant impact on the GDP of countries, much higher than the positive impact that many of the policies that governments put in place do to increase the GDP of a countries on their own. So a current cost, but also an even larger potential cost in the future, given to the impact that alcohol has on human capital. We calculated that children, European children that did not experience drunkenness are 30% more likely to perform well at school. Meaning they are more likely to continue schooling after the compulsory age, have better outcome, and are more likely to be employed and get a better employment down their life. So we are fundamentally putting the basis for a toll of harmful alcohol consumption for the future generations and for the economy of our countries. Finally, all this has a cost also for the persons that are not directly exposed to alcohol consumption. We calculated that on average, every citizen across Europe has a hidden tax of almost 170 euros to pay for the consequences of alcohol, independently from whether this person drinks alcohol or doesn't drink alcohol. The next step in our analysis was to understand what were the major policy gaps on which countries should build and cover. Based on the surveys carried out by WHO, as well as other analysis that we carried out, we concluded that less than half of OECD countries have a written national policy and action plan for alcohol. This is the basis for any credible and comprehensive policy action in terms of preventing alcohol consumption. In Europe and the United States, less than 10% of those potentially benefiting from screening and brief intervention in primary care are covered by this intervention. We are not giving enough services to those that have problematic alcohol drinking, and we are not helping them enough with this problem. 72% of OECD countries do not automatically adjust alcohol taxes for inflation, particularly in the time where there is a high level of inflation. This fundamentally erodes the impact of taxation on preventing buying, and is particularly important to maintain this for younger people. The majority of countries does not have the most effective regulation of advertising, and in particular, we need to do much better on regulation of advertising on social media, which is something that we are not yet addressing to the extent that is needed. To close this gap, countries have a bouquet of potential policies. We looked at the potential policies that countries could implement, starting from the WHO Safer Network and looking at the evidence and the type of information that countries need to implement these policies. We carried out an assessment on the health and economic assessment of these policies, both in terms of their impact on population health, but also in terms of savings on healthcare expenditure, improvement in labor force productivity, and on return of investment. As you can see from this graph, the 13, if I recollect well, policies that we have assessed have all good impact on population health and decrease healthcare expenditure, and in the majority of cases they have an excellent return on investment. Policies such as those on regulation and taxation are certainly those with the best impact, the greatest impact, and have the best return on investment profile. In certain cases, up with hundreds of euros gained for each euro invested on this policy. We also acknowledge that single policy in isolation are not enough to tackle alcohol consumption. So we came up with a policy package that has the 4 Ps, some of which overlap with yours, but others are slightly different. For us, the policy package, the 4 Ps are policy enforcement to limit alcohol-related injuries and violence, limiting the impact that alcohol consumption has on others, protecting children from alcohol promotion, primary care to help patients with harmful drinking patterns, and finally, pricing policies to limit the affordability of cheap alcohol, which is disproportionately consumed by those with harmful patterns and by youngest. Implementing this policy package, making sure that countries have the best practices in place on these 4 pillars across the 48 countries that we include in the analysis has a huge potential impact in terms of health. We calculated that we could avoid 8.5 million cases of alcohol-related non-communicable diseases. We could save to the expenditure of our healthcare system something such as $28 billion every year, which correspond roughly to the health budget of Israel. We could save the healthcare budget of Israel across the OECD by implementing these policies. We would improve the productivity of our workforce by something in the order of magnitude of 3.9 million additional workers across the countries. And finally, every euro invested in this package would give a return on investment of around 16 euros. So we are talking about a ratio of 16 gained for each single euro invested. We also tried to address some of the typical comments that we get from industry when advocating for this type of package. In terms of, for example, will reduce employment, there will be high cost of implementation, it's not possible, it's not feasible, and so on. And we calculated, we put together the evidence to respond to these type of questions, acknowledging, yes, of course, some cost, but also noting that the advantages of these packages are not comparable in terms of how bigger they are compared to the implementation cost. And there are finally also some areas in which by implementing better policies, industry could also get a gain, in particular on scaling up enforcement against illegal sales. That's an area in which there could be some advantage for industry. And then also in certain well-calibrated taxation may provide incentives for reformulation by offering option to combine lower ethanol and without a loss of financial revenues. There is a new chapter that is going to open, which is on no alcohol products that, in my view, should be treated as a different type of product, and we should also ensure that there is no potential spillover effect, for example, in terms of advertising, between advertising no low alcohol that has very similar names to products that instead contain alcohol. So that's certainly an area in which more work needs to be done, and ensuring that we don't advertise low alcohol and no alcohol product as if they were alcohol products. Finally, I stop here. I thank you very much for your attention. I saw that some of you took photos. If you go on oe.cd/alcohol2021, you find the publication. All our graphs are downloadable in terms of Excel files, so you can use them and use them as you wish. Thanks again for your interest.
Thank you very much, Michele, for this very important study and for those very necessary elements of advocacy in favor of ambitious alcohol policies. Again, we have some time for a few questions if you have some, so please don't hesitate to raise your hands if you want to ask something, Michele. Yes, we're sweating.
I'm so intimidating.
Yes, please.
Yes, I have a question.
For those who are behind the screen, we need the microphone. Just here. Yeah. And can you introduce yourself, please, as well?
Yes, thank you for the presentation. I'm Christiane Dugstad from the Norwegian Directorate of Health. I was wondering, because you didn't mention the alcohol industry like Eurocare. So how do you think we should address the industry and
Well, I don't think we can ignore simply the industry, but I think that we, as public health expert, we have an objective of pushing for public health. So I think that should be our light at the end of the tunnel. As OECD, what we try to do is to help the various stakeholders, public health institutes, NGO, civil society, to provide them with the evidence that can use to make their point. And also to find some of the answers to respond to some of the common issues that are raised by alcohol industry. I mentioned some in terms of employment, for example, in terms of reduction of revenues and so on. These are all things that we need to have clear evidence on. I think the evidence stands with public health points, and we need to respond to these ones.
Thank you, Michele. And I think we'll talk about alcohol industry in the second part as well with Marc Petitcroux and Myriam Savy. Maybe a second question on the chat and then a third question afterwards. In your opinion, Michele, what would be the best way to make an efficient alcohol taxation, weight of alcohol or volume or something else?
It's very difficult. There is a lot of work ongoing on the level of taxation. To me, the most important thing and the top priority, because we are not there yet, is to make sure that the overall level of taxation meets a predetermined and sufficient high share of the total price. For tobacco, for example, there are clear recommendations on the minimum amount of taxation that should be met in principle. I know that there is some ongoing discussion whether there should be something similar for alcohol. At the very minimum, I showed that 72% of countries do not adjust for inflation. That's really the bare minimum that I think we should aim for.
Thank you very much. There was a question over there. Thanks.
Is it working or not? Yes. Okay. So hello, my name is Sandra. I'm coming from Slovenian National Institute of Public Health. Thank you for the presentation. I have just one question just to get an idea. How did you calculate this? You showed lowering life expectancy around 1 year, and you show differences between countries, and it's not corresponding to the level of consumption. So I'm wondering what else was calculated in this. I'm sure that it's complicated, but if you can do it in a simple way for us to understand.
Absolutely, I'll try. But you find a lot also on the literature. If you Google, for example, you go on PubMed, my name or the colleague that leads the work on alcohol in our team, Marion Deveau, you will find the literature. But fundamentally, for calculating this analysis, we have developed a microsimulation model, which currently covers 52 countries across the world, and we include all the various dimensions. There is the epidemiological dimension, of course, in terms of incidence of diseases, but also fatality. So, for example, to respond to your question, another dimension that is taken into account is access and use of healthcare services across countries. Fundamentally, once that the person developed the disease, how well the system of the country is able to address the diseases. Clearly, countries that have better performance in dealing, for example, with cancer have, in a way, absorbed some of the extra burden that may derive from different level of alcohol consumption. Others include, for example, the age of the population and so on and so forth.
Thank you. Thank you, Michele. One last question from my left, from Florence.
Thank you, Michele. I also have a question on the cost of alcohol to society. In my presentation, I mentioned the harm to the user and the harm to society, to the non-user. Was the cost to the non-user included in the cost to society? And if not, could that be, introduced, because it's so huge?
Some of the costs are included in our analysis, some others are not. For example, in terms of health cost, there are all the costs related to injuries. if there is a road traffic accident, people that are not necessarily drinkers may be involved, and that's included. In terms of workforce productivity, something is included, but for example, we don't include anything related to litigations related to harmful alcohol consumption between persons that are drinker or not. So I would say that our cost, for example, the hidden tax of 167 euros per year is a conservative estimate of the cost of alcohol.
Thank you very much, Michele. Thank you for
Thanks.
your presentation and the question and answers. Well, I think thanks to you, Florence, and to you, Michele, we now know what has to be done. I think now we need an inspiring example of a country which successfully managed to implement some of these very useful measures. So it's my pleasure to welcome now two speakers from Ireland. Katie Dunphy, who is working at the HSE, Health Service Executive, which is the organization in Ireland which runs all the public health services. And also Sheila Gilhenny from Alcohol Action Ireland, a NGO, a national NGO dedicated to alcohol advocacy. So please, the floor is yours.
Thank you very much. Lovely. So today we're here to talk about alcohol harm reduction in Ireland and the research into policy and practice. So it's a co-presentation, so it'll be both Sheila and I that will be talking today. So the way we framed this was to frame it in the form of the WHO focus areas, as already mentioned. So looking at alcohol pricing, alcohol availability and marketing, health information, health service response and community action, just to give a bit of context to the work that we're doing in Ireland. Okay, and so then we have to also look at the Irish context. When we talk about this, we are looking at it from an Irish perspective. So in Ireland, there are 2.9 million people in Ireland who drink alcohol, 1.5 million who drink harmfully, and 578,000, or that equates to 1 in 7 people who are dependent drinkers. So I'm going to pass over to Sheila. I'll come back. So I'll talk to you then.
Thanks very much. So yeah, really, no matter how you look at this, we have a problem in Ireland. 15%. Sorry, 15. Like I say, we could pick out any number of statistics really to give you an example of the impact of alcohol in Ireland. But I'm always taken myself by the fact that 4 people die every day in Ireland. It's a small country, so we actually know an awful lot of those people who die. And everyone who dies, you can just imagine the ripple effect in the family and the hidden harm, the impact on so many others at the same time. But if we come back to economics, and again, sometimes this drives me mad because the economic argument is so strong, I cannot understand why we still have this problem. But we know that, for example, 11% of our healthcare budget is impacted by alcohol. And, I'm so struck actually when we were looking at the OECD statistics actually that our tax burden in relation to alcohol is actually 460, I think, euro per year. So imagine that average that you had quoted earlier on was about 170. So it's a massive, massive burden on Ireland. So what do we need to do about it? I'd say lots of other statistics that we could throw in here, but I almost don't want to linger on it. I'd like to move on to possible solutions that we could find. So back in 2018, the government did actually move on trying to regulate alcohol. And this is the first time in Ireland that a public health approach was taken to trying to control alcohol or to try and put policy shape around alcohol. This particular act there's a whole load of measures in it, and it's really framed around the WHO best buys. It's trying to put controls on pricing, so that was like minimum unit pricing, controls on advertising, and there is, you know, some that's there, nowhere near as good as what we would see in Norway, for example, and I'm going to come back a little bit to that, but some a little bit about the placement, where you can get alcohol, the fact that it should be separated in shops and things like that. Not everything has yet been introduced. When we wrote this, this talk originally, I had labelling over on the yellow side as not being implemented, but events have overtaken us, and we've moved a little bit further, and I'm going to come back to that in a moment. But some of the things that we're still not there yet is those controls on advertising. So a broadcast watershed, that we shouldn't see alcohol ads before 9 p.m. Content, the myth making that we see in advertisements, that's supposed to be stripped out from it, and a couple of other things as well. But, you know, it's good, but it's not good enough. And I do find when I'm at meetings like this, and people are going, oh, Ireland's doing great stuff. And I go, yes, we are, but we could be doing so much more. And I'll show you why I feel, you know, that's not enough. But I suppose, no. Before I get depressed, I'll point out a few of the good things. We do have minimum unit pricing, and this was incredibly important to have, because basically before this act came in, or before minimum unit pricing came in, it was pocket money price to buy alcohol. A man, for example, could buy the low risk drinking guidelines for, you know, under a tenner, €8.49. Women could buy it for, you know, just over a fiver. Now, with minimum unit pricing, a man would have to pay €17 and a woman would have to pay €11. So it's not great, but it is something. You'll get a sense there just of what the prices now actually look like. Will MUP work? Well, we know from the modelling of MUP that there's an expectation that there will be reductions in various things. So we would hope to see reduction in literally the amount of alcohol that is drunk. We would hope to see a reduction in hospital admissions. We would hope to see a reduction in deaths. So there are some things that we know have been modelled. Will we see it? We're not quite sure yet, but we know when we look at Scotland that we are seeing some similar effects, you know, there. We are doing some research on this, and actually the HSE are funding this, so this is just a sneak preview. This hasn't been published yet, but there is some work being done on the impact of MUP on admissions or on presentations to emergency departments. And that, you know, really took quite a careful look. It looked at, you know, exactly who was coming into an ED just before MUP was introduced, and then 3 months later looking at it again. And what we think we're seeing is a reduction of about 7% in presentations to ED. That's just in one hospital. And the thing that always strikes me about, you know, positives in public health, the people who didn't fall down the stairs, the people who didn't get into an accident, the people who weren't pushed over the edge, you know, maybe with a particular illness, they don't know that. They went on their merry way. But we know it. We in the public health community do know it. We see it. We know there was a reduction. We know that there was a bit less pressure being put on emergency departments during that particular phase. So I always feel it's very important for us to celebrate and to know that even if we aren't the person who doesn't have a broken leg on this particular occasion. So it is something that's there. In terms of whether we're seeing a decrease in alcohol consumption, well, MUP was just introduced in January 2022. We had already had a reduction in 2020 and 2021 because of COVID, because so there was a huge amount of restrictions on hospitality. But if we compare the amount of alcohol that was drunk in 2022 with just before COVID, so back in 2019, we're seeing about a 5% reduction. Is that all down to MUP? I don't know. Because that's just an overall figure that's there. But it certainly is a helpful thing, and we would hope with more research to be able to make that more definitive, but at least it is something, at least it is a reduction. Structural separation in shops, that was a very important element as well to bring in. It's about trying to give this idea that alcohol is no ordinary product. It shouldn't be for sale beside pasta or the vegetables or milk. It should be somewhere else. And we're really, really pleased about that. That has happened. Now, I will say, as with everything, nothing is perfect. What we are seeing is that outside of the alcohol zones, and this isn't a very good picture, I actually had much better pictures, but somehow didn't put it in, that we're seeing a proliferation of zero alcohol products being advertised, and exactly just as what we were talking about earlier on, this is having a considerable impact because it's using identical branding. We do know that in the other areas where there are restrictions, like on public transport, we're not supposed to see alcohol ads there. We're not supposed to see ads within 200 metres of schools or on the field of play during sports. So what instead we're seeing is zero alcohol products being marketed in all of those areas. And this is proliferation. It's actually unbelievable. And for me, now I'm not a rugby fan, which is great. I spent all my time actually just looking at alcohol ads. But it's not just me says this, you know, there's been some good research that's been done on that, and we're seeing alcohol brand references appearing in some of these very high profile rugby matches once every 8 seconds. So I often think to myself, are you watching rugby or are you watching one big long alcohol advertisement? It's quite significant. So we are pushing our government to go back and to look at this and to really say what needs to be adjusted here. We actually think that our own legislation is strong enough that it does cover this. It actually says its definition of advertisement is to say a statement of the brand name is of an alcohol product is an advertisement. But we have to persuade. And we were a little bit encouraged, I have to say, that our Minister for Health a couple of weeks ago, 3 weeks ago actually, did say this is a problem and this has to be addressed. Just to give you an example of why I say that it is a problem, you know, zero alcohol products make up about 1.5% of the alcohol market, but the advertising that we're seeing it in those restricted areas that I mentioned, it makes up 25% of the advertising spend. I think, you know, the case is there. The industry are no fools. They wouldn't spend that amount of money for such a small amount of the market unless they thought it was going to have an effect on their overall all sales. So, back on to good news again, you know. Labelling, this is something that we have worked for a very long time. It's actually 10 years since a report came out which recommended that we would have labels. The legislation was passed in 2018, and I will just say that that was the most contested piece of legislation in the history of the state. Our state is 100 years old, and this took 3 years to actually get through. It is the single most contested piece. But the labels themselves, you know, I describe them as being modest, but they are significant. And I think you had a close-up there earlier on, so you can kind of see it. They tell the truth. They put the facts. They put them there. But the thing that really tells me that they must be significant is the level of hysteria that we're seeing from the industry about that. And, you know, just to give you a little bit of the flavour of things that have been happening recently, you know, in order to have these labels, because it was seen as a derogation from the single market rules in the EU, the Irish government had to say what the labels would look like. They had to notify the EU. There was no dispute from the Commission about this. In fact, actually, the Director General for Health, Stella Kyriakides, in an answer to this question, said, you know what, the Irish government demonstrated that the problem in Ireland was such that this was a necessary and it was a proportionate measure to the scale of the problem that we had seen. She saw all that information that we would have seen at the start of the talk. It was proportionate to the scale of the problem that we have. So in May 2022, just a couple of weeks ago there, the Irish government, you know, went ahead and has, you know, signed into law these regulations. Now we know there's an awful lot of jumping up and down with industry, and the tack that they're using at the moment is to try and work through the World Trade Organization. The Irish government notified the WTO about this. We know there's going to be a meeting in the next couple of days about this, and we expect there will be lots of jumping up and down. But there's no reason why we shouldn't do it, because these were legally passed, they were debated in Parliament, they've gone through all the processes. We have a right to put whatever labels we want on our products. So we're really putting it up to our own government to stay firm on this, to stand up for its citizens' rights and its citizens' right to know the risk from this particular product. And we're very proud that this government, our government, are actually doing that at the moment. However, back to bad news again. And this is the way in alcohol policy. It just goes like this all the time. I go these tremendous highs and then there's lows. And our, our low at the moment is we still have a government who, in another department, the Department of Justice this time, are pushing for a thing called a sale of alcohol bill, which will extend licensing hours and extend the number of places where you can actually buy alcohol. And this is so frustrating that on one hand you have a Department of Health who are doing good things, and you have a government, you know, who has said that this is the right thing to do. And then on the other, we have another wing of the government, and we're constantly pointing to, you know, these ridiculous anomalies that are there. But that's what we have to do, and we have to keep saying it, and we have to keep pointing to it. And one of the reasons I think why I am glad to see Ireland in the news for alcohol policy is that I hope that that actually increases the pressure to say, come on, you're getting all these plaudits around the world, you know, like, you know, the Minister for Health was being photographed with Dr. Tedros and at the WHO a few weeks ago. You need to stand by your policies at the same time. So when we think about government, this is where we hand back. Why is the government in this particular way, or how are things actually being organised? So I'll hand back to Katie at this one.
Thank you, Sheila. So when, as you just mentioned there, we have multiple departments in Ireland. So we have 18 departments. And as you can imagine, those 18 departments, the alcohol is actually in a lot of those, in a lot of their policies, or should be in a lot of their policies. And sometimes they're conflicting, like you just mentioned there with the sale of alcohol bill. That's from the Justice Department, completely conflicts with Department of Health. And many here are from different government departments and health. And you probably find the same across the country, that, you know, you're fighting the good fight, but it's been pulled back by other policies in other different departments in different areas. And it does touch on different areas. I mean, from education to children to enterprise trade and employment, finance. It's such a cross-cutting issue that it can't be looked at in one silo. But I am only speaking from one silo, so I'll continue on. The Department of Health within Ireland, there's 12 divisions that cover this area of work. So they look at policy, resourcing, health promotion, etc. And then Healthy Ireland is meant to be a cross-cutting piece of work as well. That it was launched in 2013, but it looks at improving the health and well-being of our population. So increasing the proportion of people who are healthy at all different stages of life, reducing health inequalities, and protecting people from threats to their health and well-being, and to create an environment where every individual and sector can play their part in achieving a Healthy Ireland. So the Healthy Ireland is meant to be going across a lot of different policies, a lot of different governments, a lot of different departments, and comes in especially under the Department of Health. And then my programme of work is under that Healthy Ireland programme, under health and wellbeing, and it's our alcohol policy. So there's a lot of different measures to our alcohol policy, and we're putting an implementation plan to try and address some of the issues and some of the challenges that alcohol brings across 6 different key actions and milestone areas. I won't go into all of them there, you can see them. So I know we're cashing off for time. But then we go back as well to, as part of this, we have the Ask About Alcohol. And when Florence was showing the one of her images of the alcohol and the labels, the Ask About Alcohol site is on that. So this is really important information provision for the population of Ireland. Prior to this, there's a lot of different conflicting places that people can get their information from, the likes of alcohol economic operators. I won't name them directly in case I get myself into trouble, but they have their own sites, they have their own information, and not all of it is in line with best practice and in line with what we should be hearing. So the HSE have its own website, askaboutalcohol.ie, and on that website it's reviewed every 3 years, and it has, it's peer reviewed every 3 years, or research reviewed, and the information is evidence-based and correct. So that's what we have to promote and make sure that is the information that is spread out there. Apologies. And that's what it looks like. So you can see there some of the key areas that are on it. And then that, as I said, is changed every 3 years, reviewed. Anything that's incorrect, corrected. Then the other source of information provision is with the Drug and Alcohol Helpline. So we have a helpline in Ireland that gives information and advice. So not everybody wants to read, not everybody, we have to be aware of literacy issues. So not everybody has good literacy, health literacy, and may need to speak with somebody. So we have a Drug and Alcohol Helpline that also uses the information from either the drugs.ie website from the HSE or from the Ask About Alcohol site as well. So then when we speak about SAFER, when we speak about the WHO's focus areas, one of those would be around facilitating access to screening, brief interventions and referral and treatment. So when we talk about the health service response, we look at those 4 different tiers and how we can meet the needs of people across those different tiers, from the very, very early stages in with primary care or in their community. And we have 2 different programs of work. So we have MEC, which is Making Every Contact Count. And then we have another very alcohol and drug specific program called SARE. And they both have that early initial assessment and screening and referral where necessary. And then we have we hit the targets of, meeting the needs of others who require, I suppose, more advanced sessions or who would require more intensive treatment. So. And then this is a piloted program under our Slánta Care program. And this is a different model again. So this program is a specialist alcohol program that intertwines and interweaves within communities. So we have 2 pilot areas in Ireland where there's a service, there was an assessment done in that particular region, and it was determined what the actual needs were, where the gaps were, how the different organisations were interacting, where people were missing a service. And then this integrated alcohol service was put into that place to meet those needs. And it's across psychosocial and therapeutic interventions. So usually around the tier 3 mark. Okay. And we also have, while that's us in the health and wellbeing and in the HSE, we also have our sisters in within the HSE who would look at the more, I suppose, the higher needs in the area of drugs and alcohol, so the more intensive treatment and interventions. And then I'll wrap her up after this. So in our focus area 6, we look at community. So we have in our community, we have our drug and alcohol task forces. And in our drug and alcohol task forces, they were initially set up to deal with some of the drug issues predominantly in the city areas of Ireland. And they've been operational since 1997. And then they realised that, okay, drugs are actually a bigger issue across the country. So they introduced regional drug and alcohol task forces to go with the local drug and alcohol task forces. And then they realised, oh wait, alcohol is actually a drug. It is a big issue. And then that became a remit within the drug and alcohol task forces within Ireland. So that is that community approach where each area would look at the needs and they have a big focus on the prevention side within the communities. And then we have like our fabulous NGO, Alcohol Action Ireland, led by Sheila Gilheany. We also have Alcohol Forum Ireland, led by Paula Leonard. And that is a very important driver as well for that community advocacy and that community piece. And They actually launched the ICAN, which is Irish Community Action on Alcohol Network. They launched that in 2017 to support those local drug and alcohol task forces with a collective voice for the community action and the community issues that were there and that were in place. And one example of this work is actually recent, and it came up in one of the sessions earlier, and it was quite relevant, was around the work that they did from a community level on alcohol-funded initiatives in schools. So we had economic operators or alcohol-funded company coming into our schools, giving education to our secondary school students, which is our teenagers, around alcohol and alcohol use, which, you know, isn't ideal, absolutely. And between Alcohol Action Ireland and Alcohol Forum Ireland, particularly through ICAN, they campaigned on the need to remove them from this situation and from this this environment where they should never really have gone into anyway. But this is just an example of the power that the communities can have. So when we look at all of the different World Health, the European World Health Organization action areas, we look at all the different measures from our from the laws that we're implementing, some good, some a little sketchy, could be better. And we look at the community side, and we look at the screening referral, the health service response. So we have to look at this from the bigger picture and not just in our siloed pieces of work, and work with those that we can within our country. And I am just going to conclude now. Thankfully, I'm on time. I was trying to get through it as best I could. So when we look at the research, and that is the WHO Best Buys and the WHO Europe 6 focus areas, and how they can then be put into policy. So our Public Health Alcohol Act, and then our Sale of Alcohol Bill, and then our government strategies across the 18 different government departments, and then to put all of that work into practice. That's always the harder challenge, I think. And before I finish, I just want to thank Santé Publique France, sorry, and Jennifer in particular for all our conversations and organising and everything. So, sorry, my voice is going. Probably a good time. I'm finished. Yes. So thank you very much for inviting us over and giving us the opportunity to network, to meet with others, and to share what Ireland are doing and what we're trying to do. So thank you.
Thank you so much, Katie and Sheila. Ups and downs, highs and lows, but nevertheless, quite many highs. So congratulations for all this work. We'll take a few questions before the break. So please, if you have some questions for Katie or Sheila, raise your hand. Yes, please.
Je vais donner la question en français. François Desbiens de l'Institut national de santé publique du Québec. Oh, yeah, I'll try in English. I'll try it. Okay. I'm François Desbiens from the National Public Health Institute in Quebec. To be able to have a healthy public policy like the one you have, you need to convince some politicians and to mobilize them through the time. What is the little story behind the strategy you put on to secure the mobilization of politicians through the years to arrive at this level of policy?
If you can go there so that the camera can see you.
So I will say that all of that policy that I talked about really stems back to a report in 2012, and that was chaired by our CMO, the Chief Medical Officer at the time, who was a remarkable individual. And he very much is the person who pushed, firstly, to get the report through and to have it there. And that formed the basis of the legislation. To get the legislation through then really required a huge amount of advocacy across multiple different groups. So Alcohol Action Ireland was involved in setting up a health alliance around alcohol, which had about 60 different organisations. And I think as each bit of the legislation was going through, you know, we worked on a very kind of dedicated sort of way. So when we were talking about labelling, for example, with its cancer warnings, we very much looked to others who were working in the cancer field and different organisations there. When we were talking more about, you know, say advertising, we were seeking out, you know, who are the people who were best placed to talk about that. So it did take an enormous amount of work, and I will say, you know, the scale of the opposition, you know, to what I really still consider are quite modest measures. They're not dramatic actually, but it did need, you know, all of that kind of work, and was very much literally, you know, working with individual politicians and trying to build up support for any, you know, maybe a particular measure at a particular time.
Thanks a lot, Sheila. Another question in the audience? Yes, Marion? Can you introduce yourself quickly?
Hello, my name is Marion Deveau. I work at the OECD. So I have a question about minimum unit pricing. So you mentioned in the presentation that minimum unit pricing led to a 5% decrease. May have, yeah, exactly. But you don't know exactly what are the real impacts. So my question is whether there will be, or there is ongoing study, or will be some study, a scientific study of the impact of minimum unit pricing in Ireland, and whether there is some evaluation ongoing on the impact on different socioeconomic groups.
So I'll maybe just answer this particular one. So yes, there is a public health alcohol research group which was set up by the Minister for Health when the Act had gone through. And it has, you know, made, it's about to publish a report actually just on what should be done. There has been a small amount that has been done, but there's an awful lot more needs to be done. And I think really something that we would be, and this is an Alcohol Action Ireland view, we would be advocating very strongly that we need to have a very strong alcohol office, which is, you know, funded to really look at, you know, the policy measures, the research that's needed about that, because we would say that is lacking at the moment, that there isn't sufficient I suppose capital, if you like, you know, policy capital, you know, in there to develop that. I actually do find the OECD work incredibly important actually in this. When we had a meeting with the Minister for Health, and we were just saying, this is what the OECD say, because you're economic people, and we know his particular background, that would appeal. But we need more people saying that, and we need it very much from that, as I say, economic perspective. So I'd be really encouraging you to say things like that out loud, and in any dealings that you'd have with our government and others, because it is effective. It's very powerful, much more so in some ways than, you know, the people in the health community. It's very important that is, but I know sometimes what changes minds is economic arguments. Okay.
Thank you, Sheila. Another question, maybe for Katie or Sheila? I don't see any question in the chat. Yes.
Emanuele Scafato from National Institute of Health, Rome, Italy. Sheila, what will happen after the World Trade Organization discussion about this label? What will happen if they will say that you are not allowed to put this kind of message on the bottle?
So it's not up to the WTO to tell us that we're not allowed. We are allowed. We can do that. What may happen is that, you know, perhaps a particular company might perhaps try to take legal action against the measure. So, for example, in Scotland, the Whisky Association, Scottish Whisky Association, would have tried to take legal action against the Scottish government in relation to the introduction of minimum unit pricing. And that went through a court procedure, there, and came out in favour of the Scottish government, you know, being allowed to do that. I don't know if any particular group will take action. There's a lot of talk. You know, there's a lot of things that are out there. You know, for example, some of the wine industry have lodged a complaint with the EU about this. But you know what? Anyone can lodge a complaint. I could lodge a complaint. Anyone can do that. That doesn't mean that, you know, something has to specifically happen about that. And for the moment, and for certainly what we would be saying is, we are proud of what the Irish government has done to date, and we're saying to them, you can do this, and they know that they can do it and continue to keep with it.
And if I may, every piece of legislation in tobacco was challenged, and we won them all. And we will them with alcohol as well. Sorry, alcohol industry, you could try, but you're going to lose.
Yeah.
Thank you. Thank you, Sheila and Florence. Yes, please, Dorota. Can you send the microphone to Dorota at the back, please?
Yes, hello. Hello. Can you hear me? Yes. Hi. Dorota Sienkiewicz, EuroHealthNet, based in Brussels, Belgium. I have a question about the role of shaping the public perception towards the support of the measures such as minimum unit pricing, and have you worked with just general public on like shaping the audience to be receptive to that and maybe like presenting it in a positive way?
So yes, I'd say we've done a number of different things. Firstly, we ourselves are very active in the media. We put out a lot of press releases ourselves, and we're frequently asked for comment on the media. And we use those opportunities to put forward the public health perspective on alcohol. And we feel that does help shape the thing. What we actually know is that public opinion is already effectively on our side, and we know that actually through polling data that we would carry out. And it is very interesting to see so far in labelling, for example, and the advertising, about 70% of the population are in favour of measures like that. I will say that when it comes to MUP, maybe not just as popular, but still actually quite strong. Over 50% of the population would support it. And generally speaking, you do find that when you get a chance to talk to people, when you get a chance, to put forward the case in the media or elsewhere, people get what we're saying. When 15% of the population have an alcohol use disorder, everybody in the country knows somebody who has a problem, and that's either themselves, in their family, or very close to that. These are not unpopular things to actually do. What is unpopular is, I suppose what I would say, I don't mean unpopular, but we have an industry who regard it as unpopular, and they will put forward the thing of, oh, people don't want, and they will accuse this of nanny state stuff, but actually the people do. Sorry.
Would you say that the current rising cost of living crisis is helping it, or actually undermining your work in this particular field, and maybe how the industry is kind of hopping on it to maybe further undermine your work?
Yeah, I mean, that is a difficult one, and certainly it'll be something that will come up, in media discussions. But the price of everything has risen, and we just sort of have to look at that. It is one of the reasons why we say that taxation should be index linked, so that we don't have to keep on having a discussion about, that in the face of it. We know, and we do know the industry will use that, and they also use arguments like, oh, it's a taxation on the poor would be one that would be there, which is why I find the Scottish data, which shows that the deaths, the lives which were saved through MEP, the people who didn't die, were mostly coming actually from people in the poorest areas of Scotland. So we try to turn, I suppose, those arguments on their head and actually just look at what the reality is.
Thank you, Sheila. We're running out of time, unfortunately, so I'd like again to thank our four excellent speakers for sharing their knowledge, for accepting to sweat with us against alcohol policies. Really, really, thank you very much. I think you can applaud them. I look at Jennifer. I think we'll do a very short break, 5 minutes. Please come back after the break. I know it's very warm. We're sorry for these not so perfect conditions, but a quick shower and you come back. Maximum 3:35, 3h35 maximum. Very quick. Thank you.
Hello, everyone. I am very happy to be in charge of this second session. Thank you very much to Santé Publique France. Very interesting session, international session. We have a lot of international exchanges. And we have very nice example of what to do, what is the diagnosis of the problem. And you see, we have to really make the population realize about the damages. We have a recent report in France telling us that more than 20%, 25% of the population believe that alcohol can protect them from cancer. So you see from far we are starting. I would love also to have good news, but no alcohol action plan in France. I don't know where. I would love to be optimistic, such as Florence, to say we are just waiting for good news. So now for this session, a very important session, because also people on the politicians also maybe realize how alcohol industry is powerful, because we are always saying that, but we have to be really trained to know their strategies. They are very powerful, they are very vicious, because I will just begin the session with one story. I don't know if you know this one, but 5 years ago, the NIH built a clinical trial to maybe demonstrate the impact of alcohol on cardiovascular disease. The clinical trial, the name was MAC, Moderate Alcohol on Cardiovascular Health. So at that time, they accepted that the alcohol industry fund the clinical trial. It's $100 million on the alcohol industry. So you have Carlsberg, Heineken, Pernod Ricard, putting 2/3 of the funding to this clinical trial. So two things. It means that maybe 5 years ago, we have to launch a trial to demonstrate potential effects on alcohol on the cardiovascular effect or protective effect. So meaning that if you want to put such amount of money on the table, there is no clear demonstration that alcohol may be protective for the cardiovascular system. And the problem is how powerful is the alcohol industry, because why they stopped 6 months later, the NIH had to stop the clinical trial, because they realized that the alcohol industry was making all its effort to bias the clinical trial to put all the chances to demonstrate that it could have a beneficial effect on cardiovascular disease. So it's really powerful way of orientating here a clinical trial with such impact worldwide regarding, of course, the impact of alcohol on health. So we have to begin to keep to stay on time. So it's my real pleasure, because I didn't meet him yet. It's Professor Mark Pettigrew from the London School of Hygiene and Tropical Medicine, and I'm sure you know it. You know him because maybe you read the paper. He published a paper recently with Karine Morvan-Galopel, that who everybody knows, about the Evans law. Very interesting paper to see what is remaining of the Evans law, and I remind you that Evans law is a very important thing. It's an example at the international level of how we could regulate advertising. So it's a real pleasure to welcome you to present your work about how alcohol industry is manipulating our mind.
Thank you. Many thanks, Mikael. So I'll manipulate your minds for the next 20 minutes, if that's okay. I've got a strange throat at the minute, so I hope I don't lose my voice, so I'll try and talk quickly. So thanks very much to the organizers. Thanks to Jennifer and Viet and colleagues for inviting me. It's been a fantastic opportunity to come and hear about these issues across countries and to talk about them. So it's been a great opportunity for me. And so thanks for the invitation. Thanks to the translators who have got their work cut out for them, I think. So I'm a public health researcher and at London School of Hygiene and Tropical Medicine, and part of our work looks at the activities of tobacco industry, alcohol industry, fossil fuel industry, gambling industry, and so on. So I just wanted to say a bit about this. That's my declaration of funding, so no alcohol industry funding, you'll be happy to hear. So I thought it'd be useful to start by reminding us what the aims of the alcohol industry are. And as we've heard, the aims of the alcohol industry are to defend and expand the national market for alcohol, nationally and internationally in every country, to actively displace public health from the alcohol space,
And that's why the alcohol industry funds alternatives like charities, alcohol industry funded charities, education campaigns and so on. So I think this is one of the, I suppose this is an early message I wanted to get across, that we sometimes think, certainly in the UK, that it's a good thing that the alcohol industry gives money to charities to do health education campaigns or public health campaigns. I think that's a massive mistake, and it's incredibly naive of the public health community to think that the alcohol industry has any place in contributing to public health. The alcohol, it seems obvious, but the alcohol industry is not a public health expert, and we have to be very careful about the erosion of boundaries, because they aren't partners, they're not complementary. I think we sometimes think in public health that the activities and funding from the alcohol industry can complement what we're doing. I think the unspoken aim in this slide is that one of the goals of the alcohol industry is the erasure of public health. It actually wants to erase public health and public health experts, and for the alcohol industry to be the key provider of public health information and health education to the public. So we see that time and time again. And the other aim of the alcohol industry is to promote and sustain an unregulated, self-regulated industry. So as we've heard from some of the earlier examples, that the alcohol industry wants to maintain and regulate its own space. It's profoundly anti-regulation, as you know. And the strategies that it uses for achieving these aims, you will have seen, policy substitution. So it will bring forward alternative policies, alternatives to regulation of marketing, and policy substitution is the purpose of the alcohol. And it's why the alcohol industry funds charities like Drinkaware in the UK, Educalcool in Quebec, Drinkwise in Australia. These are not charities, these are alternatives to effective regulation. They're alternatives to effective public health interventions. Lobbying, you know about, excuse me, voice is going wobbly. It's the emotion of the topic. It promotes public misinformation about the health harms of alcohol consumption, as we'll see, and as you know. It promotes education campaigns. I've put that in inverted commas because their aim isn't education, it's the promotion of alcohol and alcohol industry narratives. Corporate social responsibility campaigns, it undermines science. I won't go through the list. These are all the things which the tobacco industry did, and the alcohol industry is doing them right now. And it often sort of strikes me that we ask ourselves sometimes, teaching students and so on, students will say, but whenever the tobacco industry was secretly running journals and putting tobacco industry consultants in at the heads and the editors of journals, how did we not know any of this? How did this happen on our watch? And I say, yeah, it's happening right now. There are alcohol industry consultants running public health journals and alcohol journals. So this is what it looks like. This is what it was like. It's the replication of the history of the perversion by the tobacco industry of science. The alcohol industry is doing it today. So the sorts of framings and arguments that the alcohol industry uses, excuse me, you'll have come across before. So it'll say in its arguments or its submissions to consultations and in the public-facing information that it produces, alcohol, it's a normal product. They use responsibility framings like drink responsibly. You'll remember, of course, that the tobacco industry also had a smoke responsibly campaign. The gambling industry talks about gamble responsibly. The porn industry, I'll let you fill in the gaps, but it also has responsibility campaigns as well. The alcohol industry focuses on harmful use in subgroups prefers to talk about targeted approaches as opposed to population-based approaches. It has a strong emphasis on behaviours and behavioural framings. So the alcohol industry doesn't like to talk about the problems of drinking specific amounts of alcohol. It likes to focus on drinking behaviours because that's the individual's responsibility. It's not the product, it's your behaviour. Problem deflation. So this, as you'll know, whenever, certainly in the UK, whenever a new report is issued which talks about alcohol harms, immediately alcohol industry bodies start to tweet and they issue statements about how the problem is declining. So that's a very standard cross-industry tactic. Whenever they're challenged, they then say, but underage drinking is declining or something is declining, which is a sort of a logical fallacy because firstly, just because something is declining doesn't mean it isn't going to decrease. And just because something's declining doesn't mean it isn't a problem. So you get this sort of problem deflation narrative. And the big one, of course, the next bullet point is peer pressure. So industry materials continually point to the problem, for example, with underage drinking as being peer pressure. The problem isn't their marketing. The problem isn't the product. The problem isn't the availability of alcohol. It's kids making other kids drink. The alcohol industry has it's nothing to do with us. It's peer pressure. So they then use that to argue that what we really need is education of school children. They also focus on parents and teachers as the problem. It's bad parenting and poor teaching. It's everybody else's problem except the alcohol industry. So the other thing I mentioned at the start that the alcohol industry funds a range of different organizations. Some of them are public charities which disseminate information to the public about alcohol harms. And this is part of the alcohol industry's corporate social responsibility strategy. It's a responsible producer, it says. Look, it says to policymakers, you don't need to regulate us very closely because we already educate the public about the harms of alcohol consumption. So nothing to see here. So one of the issues that we've analysed over a number of years is the misinformation which is disseminated to the public by alcohol industry organisations across different countries. So we know from this that the alcohol industry engages in cancer denialism. So the alcohol industry denies in different ways that alcohol causes cancer. There's no dispute about this. We've known about the relationship between alcohol consumption and breast cancer for about 40 years, possibly more. There are hundreds of studies. But the alcohol industry denies that relationship in different ways. And one of the interesting shifts that has happened is that the alcohol industry has shifted from outright denial, what's sometimes called hard denial. So it no longer says overtly that we don't believe that alcohol causes cancer. They've shifted to soft denialism, which is where they say, well, yeah, alcohol contributes to the risk of cancer, but lots of things cause cancer. Smoking, sunlight, etc. So it's this is called soft denialism. It's a hard denialism and soft denialism. The terms come from the fossil fuel industry denial of climate change, where it has shifted over the time from hard denialism, where it denies that fossil fuel consumption causes climate change, towards soft denialism, where it says, yeah, but there is climate change, and maybe humans are contributing to this, but it's also due to solar radiation and volcanoes and natural variability, etc., etc. So you see the same thing in relation to cancer denialism and the alcohol industry. The alcohol industry is not widely understood, engages in, denialism of the harms of drinking in pregnancy. So the parts of the alcohol industry deny outright that alcohol causes harms in pregnancy and denies the risk of fetal alcohol syndrome disorders, and denies in different ways cardiovascular disease, and generally distorts the evidence base. So I just wanted to look at this quite briefly. This is one study that we published a couple of years ago, where we collected all of the information which is disseminated by alcohol industry funded charities mostly. These are sometimes called SAPROs, Social Aspects Public Relations Organizations. And we found 27 of these organizations from different countries around the world: Drinkwise, Drinkware in the UK. Some of the companies actually had health sections on their website where they put out information to the public, like Pernod Ricard, for example. Well-known public health experts had a section on cancer and alcohol consumption. So we collected all of this information and analysed it qualitatively to see what they were telling the public about alcohol and cancer. And anyway, they used, we thought, three main strategies, or we found that they used three main strategies. So the first one was denial and omission. So on some of these websites, they would explicitly just deny or dispute any link between alcohol consumption and cancer, or they would selectively omit any information on the relationship. So this is, as I say, just misinformation. You're factually wrong. They would use distortion, where they would mention some cancer risk, but they would misrepresent the cancer risk, or they would hide the nature of the risk, or use very confusing language to present it. So I'll come to that. Or distraction. They would talk about the risk, but they would focus the discussion away from the independent effects of alcohol consumption. So they would say, smoking and drinking increases the risk of throat cancer. But in fact, there's an independent risk, but they wouldn't talk about the independent risk. So you get this is a tobacco industry tactic. You can see this in the tobacco industry documents. Yeah, so sorry, I was going to say I can't read my own writing, I can't read my own typing. But the other, it's not just cancers generally, but the alcohol industry specifically is very concerned about the public knowing about the risk of breast cancer and colorectal cancer. So it's not just cancers, which is bad enough. They really don't want the public to know about breast cancer or colorectal cancer. The reason why they don't want the public to have accurate information about the risk of breast cancer, it's because the consumers that the alcohol industry needs to develop most and focus on most, and it says this itself, are female consumers. So the alcohol industry is very dependent on female consumers, and it wants to develop that market. The last thing you want is women who are concerned about the risk of breast cancer. So breast cancer is a particular focus of misinformation from these organizations. So I think I'll skip through that. You can get the slides later, but basically to say that the denialism particularly focuses on breast cancer. Sometimes the risk is omitted completely. And sometimes, or quite often, what would happen would be in these materials, the alcohol industry would mention some diseases, but it would selectively omit cancer. So Diageo's Drink IQ website, which is an Australian-based website, it had a section called Alcohol's Short and Long-Term Effects on Your Body. So it would list these long-term effects: alcohol dependence, pancreatic problems, liver cirrhosis, brain damage, death, and unspecified physical and emotional health problems, but not cancer. So it's somehow managed just to forget to mention cancer. I should say that on these organizations, what you will quite often see is that alcohol industry organizations and charities, they don't mind talking about liver disease and liver cancer, because they see that, I guess in sort of commercial or marketing terms, this would be called a loss leader. They're quite prepared to take the hit on liver cancer or liver disease because the public isn't terribly concerned about liver cancer, isn't very worried about liver cancer, and quite often the public sees liver disease as a problem of old men. So liver disease, the alcohol industry, I think it takes the temperature and it says, you know what, we can afford to own up to liver disease, but stay well away from breast cancer and colorectal cancer as well. So I mentioned Educalco, the Quebec-based misinformation organization, and it's one of the worst examples of alcohol industry misinformation on cancer. So this is an example from their website at the time, where they talk about the effects of moderate regular alcohol consumption, talked about cardiovascular and peripheral disease, stroke, gallstones, diabetes, psychosocial effects, and, quote, other beneficial effects, but somehow they forgot to mention cancer as well. And elsewhere in one of their websites, they explicitly deny that that alcohol causes cancer. This is a famous quote, which I'm sure you've come across. It's from the tobacco industry internal documents, Doubt is Our Product. It's from Brown and Williamson Tobacco Company, 1969. And what we're seeing here from these alcohol industry organizations, which gain credibility from going to policymakers and arguing that we're a trusted source of information for the public about alcohol harms. What they're actually doing is creating doubt about the harms of their products. So that's explicitly part of their rationale, because it helps them to defend the market and expand the market, and it helps them to push back against tighter regulation of their products. So we've documented this across multiple papers, and so have others. The alcohol industry, of course, and these organizations deny furiously that any of this happens, and that any of this is accurate. So when we publish this, they generally write to the journal and sometimes abuse us. So, as one would expect. And I mentioned quite briefly, I won't go through this in very much detail, I've got an eye on the clock, but the alcohol industry has, again, got a very strong interest in denying the risk of pregnancy harms related to alcohol consumption. So it pushes back very strongly when you mention this or you publish any analysis like this paper. But again, this sort of denialism is absolutely built in to the alcohol industry. So these are just a couple of quotes, and these are what the tobacco industry developed, these arguments in which you appear to admit a relationship, but then you suggest all sorts of alternative causes. So these are, the tobacco industry called these alternative causation arguments. They were developed by tobacco industry lawyers. So this is the equivalent in these alcohol industry materials. So Brown-Forman, the wine producer, on its website, it says that it presents a balanced body of research with opinions on both sides of the issues. Well, that gives you confidence. They stated that the effects of prenatal alcohol exposure on fetal alcohol syndrome are influenced by factors including nutrition, metabolism, genetics, maternal age, and socioeconomic status. So this is an alcohol industry website which is saying that its purpose is to give the public information about, quote, moderate drinking. And what it's actually saying is, don't worry about the alcohol because it might be your age, it might be your socioeconomic status, might be your metabolism, it might be due to genetics. All of these things are not things which are amenable to change. You can't, and in any case, you're not going to an alcohol industry website to find out about your genetics or your metabolism. So this is typical tobacco industry misinformation. This approach is very, very common. Use of genetic arguments like this is very, very common on alcohol industry, in alcohol industry materials. So I think I've got half a minute, so I'm going to skip ahead. Oops, I've skipped too far. I don't know how to go back. There we are. Just going to finish by saying the alcohol industry is massively active in schools, and we haven't sort of spotted this. The alcohol industry, there are a number of different educational campaigns that it runs. One of them is run by Diageo, the company that makes Johnny Walker and Smirnoff and Guinness and so on. So Diageo funds theatre-based activities in schools. It says it's in 20 schools in 25 countries at the minute, and its aim is to deliver these materials to school children, to 10 million school children by 2030. This is a massive, massive enterprise. And we got hold of the materials, analysed them, and published our analysis. And the materials that they're using, i.e. they're currently using, I don't know about in France, but around the world that they're currently using to teach school children about alcohol, are really problematic. I'm going to just skip ahead. All the programs that they use, that we analysed, promote the familiarisation and normalisation of alcohol. The role of the industry itself and the role of marketing is largely invisible from the materials. They include misinformation about health harms. So the sort of misinformation about cancer and pregnancy that I talked about in the previous slides, which are given to the public, children are getting this information, now in 25 countries, by the 100,000. So children are also getting misinformation about cancers, about pregnancy, about cardiovascular disease and so on in schools around the world. And also it's distorted information about breast cancer and colorectal cancer and other cancers. So quite often they selectively leave out any mention of cancer, but they will mention liver disease. And just as an example, Drinkaware, the UK alcohol industry funded charity, its lesson on understanding the risks and harms associated with alcohol included a risk of short-term and long-term harms, but it completely omitted pregnancy and fetal alcohol spectrum disorders. So I'll just wind up, quite happy for you to get the slides. These sorts of tactics for sowing doubt and promoting misinformation, you see them across many different industries: fossil fuel industry, sugar industry, asbestos industry, gambling industry. They're documented in this book, which you'll probably have come across, Merchants of Doubt. And that's it. There are other books which cover some of these topics. David Michaels has written a couple of books. Marion Nessel has written about it in relation to food. And this is our book on the commercial determinants of health. And I'm going to stop. I'm sorry for going slightly over time. Thank you.
Thank you very much. I propose to take the question at the end. And we will move on with Myriam Savy. So Myriam Savy is working at Association Addiction France, in charge of the communication, of advocacy, and she's also contributing to the Eurocare. So I would like to say thank you very much, because you are doing a great job at the national level, but also at the European level. So thank you very much.
Thank you, Michael, and thank you to Santé Publique France for inviting me, and I have a great privilege to present some illustrations of how the alcohol industry influenced the policy decision-making process in France. I guess our two presentations are quite complementary, because I choose to speak about some case studies to illustrate how are those strategies, and I had to select for them. But I guess we can find examples for all strategies that you just described. So, of course, I don't have any link with the alcohol industry. I have to say that Association Addiction France is an association running care centers. So we help people with addictions. We work on all kinds of addictions, but on our advocacy work, we focus mainly on alcohol because it's a major health issue, and it's very important in France to have this kind of work to counterbalance the influence of the industry. So we are in a country, France, which is quite with a contradiction, because we have one of the biggest law on alcohol marketing regulation, the Loi 20. But at the same time, we have very high level of consumption. Does it mean that the Loi 20 is not effective? We can't say that, but what we can say is that the Loi 20 changes many times since it was adopted 30 years ago, and it was weakened at several occasions. So the Loi 20 we have now is absolutely not the same Loi 20 as it was in 1991, and with the social media advertising now we are like in the Far West for alcohol marketing. So that are the common strategies. I'm gonna skip this slide because Mark talked already about all the strategies. So for the case study, first I wanted to illustrate the question of how to make people doubt by taking two examples. The one is with the alcohol and pregnancy pictogram. as I think it's Florence said that France is one of the 4 countries in Europe having health warning. So in France we have the pregnancy pictogram, but as Florence says, it is not very visible, and in 2016 it had been announced that there will be a revision of this pictogram to make it more visible. We are now in 2023 and we have still not seen anything. There have been work done, but nothing adopted yet because of the influence on the policy making process. And we have a study from the École des hautes études en santé publique. So a study led under Karine Galopel-Morvan directorate, which shows what were the arguments against this pregnancy warning and the attempt to make it more visible. So what we see on the lobbying side is that when it was announced on the parliament, we saw many questions asked by the MPs who has a right to ask questions to the government, and it was a copy-paste from the alcohol argumentation, and we had like dozens of these kind of questions asked, and saying that we don't need a more visible label, it is not effective, and that we should focus on the prevention done by a professional health professionals. And of course they didn't say that for now we have 27% of pregnant women drinking alcohol during their pregnancy. So, and I also added a bit a small picture of the campaign made by Vin et Société, which is a representative of the wine industry, and they led a campaign which was called A Good Wine Can Wait 9 months to be drunk, and they created this nice bracelet to allow women to buy it and say, I want to drink alcohol during 9 months. So I think we can maybe study if it's a very effective prevention tool regarding prevention of alcohol drinking during pregnancy. Another one example is from the EU level. So the BECA committee, so it was a special committee from the European Parliament who was asked to publish a report on how to fight cancer at the European level. And in the original version of the report, we have a direct link between alcohol consumption, any alcohol consumption, and cancer, and say that it's a cancer risk factor. But because of the intense lobbying of the industry, and in France the wine industry was very much mobilized, they managed to change the words, and at the end, in the final report, we have the alcohol abuse is a cancer risk factor. And we know it's not true, but that's how they work. And here we have a quote from the annual report of Vin et Société, which is very, very interesting. And I recommend you to go and look and have a look at it, because they explain how they did and how they are happy to have won this victory. On the second example was the fact that in France, and I guess in maybe in other countries, the alcohol industry tries to be considered as legitimate prevention operators. So in France, we have we face some difficulties with president of the Republic, which is quite close to the alcohol industry. And in 2018, the alcohol industry published a contribution to the national plan for prevention. We met with Vin et Société a few weeks earlier just to know what they wanted to tell us. And they told us, it's not us, it's the Élysée. They consider us as a prevention actor. So they told us to do this contribution. So because it's a request from the Élysée, we are obliged to do this. So what we did at Addiction France is that we published a revised version of this contribution to highlight all the loopholes and the missing points on the report, to highlight the fact that we can trust the industry to make prevention recommendation, because they will forget all the information and all the elements that will harm their industry. On the right, it's an example of a campaign led by Pernod Ricard. Maybe you know it. So you can see drink more, and in a very small size you have water. So it's a campaign targeting young people to tell them to drink water while drinking alcohol. And the campaign is interesting because it's quite well done, but the message is wrong, because it should be drink less alcohol. It's better for so tomorrow you will be better if you drink less. No, they say drink more water, and you can drink as much as alcohol as you wish. If you drink water, then it will be fine on the next day. So that's what's about the prevention. And now more recent case study on the influencers regulation, because on the past 6 months we had debates on the parliament about the regulation of the influencers. As I mentioned, we have Loi et Vin in France, but at the time in 1991 social media and internet didn't exist. Since 2009 the marketing is permitted on the internet. Before that, it was forbidden because it was not allowed by the law. But in 2009, social media were not very popular. It was just the beginning, and there is a very big loophole in the regulation. So what we try to say during the debate in 2023 is that the regulation is not enough, and that on social media we see a lot of publication made by influencers to promote alcohol, to promote so that led to a banalization of alcohol drinking. And of course, we know that on social media we have young people. The Loi et Vin objective is to protect young, so it forbids advertising on television and in cinema. So we tried to show that it was important to forbid the marketing by influencers, but we didn't succeed. And what is now in the law, so it was adopted 15 days ago, the law recalls that the law applies. So it won't change anything. We are scrutinizing the practices of influencers on social media, on alcohol, since 2 years now. And we know that there are many infractions. We already have a justice decision saying that all those kind of publications are illegal. They were all condemned by the judge, but again, it was too difficult to make us understand on the parliament because the alcohol industry and the wine industry at front threatens the decision-making process, and they said that if we go more strictly on the influencers in the law, they will go until the constitutional court to make the law, so to break the law. So we didn't find enough brave and courageous MPs to go beyond this threat. And to finish on a more positive note, I had a fourth case study on a success, lobbying success, on taxation. And you know, taxation is not an easy and simple issue. But we managed to get the taxation of vinipops, which are mix of wine and sugar and water, beverage that is targeting children and young people. So we managed, after 10 years of advocacy, to have the same taxation of these vinipops as the one we had for 15 years on the premix made from spirits. So it was an intense lobbying, and you have here an example of the argumentation sent by the alcohol industry. And I even get a call from an MP that was a member of the wine lobby study group. So in the parliament you have like study groups, and even he was very shocked by the lobbying done by some of his colleagues against this taxation, because he said, well, it's not even good wine, so I'm very shocked, and it's only to make children drink, so I don't understand, and how can we do? And so it also reveals how so very slowly we can also observe some changes in the representations. So to conclude, I wanted to stress some points of what we can do, because I still think we can do things. So what we do at our level, we try to base our advocacy on evidence-based studies, on international recommendations. We, of course, try to raise public awareness, and we see that there is a small evolution and a different way of considering the alcohol use in France. So I can see that when, for instance, discussing with journalists, because so I work at Addiction France for 6 years now, and the response I get now is not the same as I had 6 years ago. And what we do also is try to deconstruct marketing and lobbying strategies. So we publish every year a report on the alcohol lobbying strategy. And the new report was published today to try to document what they do and how we have to be careful of how they do things. And on our advocacy work, we also try to collect data and to be able to support our recommendation by facts. And facts from what we observe and observation. And it's what we did on the influencers case. We have very strong data from a project financed by the public authorities. And we will continue to build on this data to push forward and to get for stricter regulation on social media. And of course, we mentioned it before, avoid manipulation by the industry. They are very powerful, and we shouldn't be naive of how they do and what they want from us. and we have to be as smart as they are. Thank you.
Thank you very much. It's a pity we have only 6 minutes for discussion and we have a lot to say, but we have time for a few questions if you have. Yes.
Okay. Allô? Just in French. Un commentaire. Donc, je suis Laurent Fleury, responsable des expertises collectives à l'INSERM. On a fait une expertise collective en 2021 sur l'alcool. Pour ça, il nous fallait 10 experts capables d'analyser quelques centaines de milliers de références bibliographiques. On a eu un mal de chien à trouver 10 experts pluridisciplinaires qui n'avaient pas de lien avec l'industrie alcoolière. Donc ça, c'est aussi un problème que, voilà, dans la recherche, il faut aussi qu'on fasse très attention au financement de la recherche. Et je pense que ce n'est pas complètement un hasard que toute la recherche sur l'alcool soit aussi investie par ce milieu-là. Merci.
Merci Laurent, oui c'est important, mais ça vient aussi du déficit de financement frappant sur la recherche sur les addictions et sur l'alcool en particulier. Effectivement, bon je vous l'avais... I have to switch in English maybe. So I told you how alcohol industry is vicious because alcohol industry like to put doubts, to put controversy on data. A big question is, okay, we published the expertise collective in CERN, but the real problem is that evidence-based data are not reaching also politicians and decision makers. When I hear you, I recognize some message that some politicians are taking for their own discourse. It's quite worrying to see that. How we can improve, in fact, how we can improve the fact that scientific data can reach our decision maker and politician. Because we do things, but it's not sufficiently effective.
I can have a go. I mean,
it's working.
It's working. I'm not sure that academics and researchers are very effective at that sort of translation. I mean, what Miriam was describing I thought is fantastic, you know, to repeatedly put the information out there and update it every year. I think that's a great, you know, to continually raise awareness is a great contribution. And actually what Katie and Sheila were talking about earlier, involving the community, it is actually the push from the community that I think, that what I take from that and from other sort of experiences is that the community driving politicians to change is massively important. So.
Any question in the audience? Yes.
Sorry, it's just a very quick one. I would often hear the argument being thrown at, well, we need balance, we need both sides, and you'd hear this from journalists in particular. We need to hear both sides of the argument. Is there any time, like, or what would your answer to that be?
Do you want to go ahead, Brian? Okay, well, my answer would be, on issues of public health, the other side of the argument is not the alcohol industry. The alcohol industry has, it's what others have said, the alcohol industry has no competence in public health. So I think pushing back, it's very plausible that you need, you know, we're decent people, we think it's a good thing to hear both sides of the argument. There is no side of the argument in relation to public health or epidemiology which the alcohol has any competence in. So I think some of this can be pushed back on because it sounds plausible, but it's illogical. And we've also caught up with that argument in relation to climate change. We've moved beyond that. So I think we need to push back on it in relation to alcohol and public health too.
Thank you for the presentations. I'm Ines from the prevention area of the Spanish Ministry of Health. I want to ask if, regarding these webs with misinformation, if there's example of countries that have taken actions that have worked to eliminate this web page or obligate them to change the information that is not true.
I don't know of any.
Me neither, I don't know. Actually, we tried to do some action to put real information and evidence-based information to create web page targeting population or targeting health professional because we realized recently that you don't have really a nice database on whole everyone should know about alcohol. Of course, you have, for example, expertise collective in CERN because it's you have a recent overview of the evidence-based data, but it's not sufficient. We have to deliver the information very simply and adapted depending on the population. It's quite a difficult task, especially during for alcohol, because it's a huge impact on different ways. So, last question. Last one.
Hi, it's maybe a little bit provocative question, but I would like
Yes.
to ask, we are always talking about raising awareness to people that people need to have right information, and right information is of course coming from the scientists that knows what they are doing and what they are talking about. I'm wondering, what is your opinion? Should we raise awareness also about the tactics that alcohol industry is using? Maybe people would like to hear, I know that young people like to hear about it. And secondly, should we raise awareness about politicians ignoring our will? Because if we look at the data coming from the different European countries, they are much more interested in making the bans or policies that are beneficial for the health, and politicians are ignoring that. Maybe we need to inform them about that. Just your opinion.
I agree regarding young people, so that's what we try to do with this annual report on lobbying strategies, but also on social media. We create a small training module for young people, and we wanted to sensibilize them with the loi 20, and because the young people, they don't know, they were not born in 1991, so they don't know what is loi 20 and why it exists. So we wanted to raise their awareness about the importance of this law. And what we decided to do was not to just say, okay, it's the law and it should be respected, but we tried to work on the manipulation and how they can be instrumentalized, because we know that's what works with them. And if you deconstruct how the influencers, so what they do is marketing and it's advertising, it's not just about how the influencers live, then they are more informed, and they can have a better understanding of what is at stake. But it takes time, and yeah.
Thank you. So just to finish, I would like to thank the speakers, and just to say, when I meet politicians, they argue, where are the public health lobbies? Wow, big question, because they tell me I meet alcohol lobbies very often, but never public health lobbies. So I would finish with like a General de Gaulle citation: where are the public health lobbies inside us? And every citizen have to request, to ask his representative to do something regarding this really harming drugs that is alcohol. That's it. I have to. Thank you. Thank you very much. So now it's the François Beck movement to close the session. François?
Okay, thank you, Michael. So, first of all, I would like to thank all the speakers for the quality and richness of their presentations, and our two moderators, and also the organizers of the session. In particular, I would like to thank Jennifer Davis from Santé Publique France, who coordinated this session with great professionalism and perseverance. As well as coordinating this session, Jennifer also organized a 2.5-day European country exchange visit with our partner from EuroHealthNet. So I take this opportunity to welcome the European experts who are taking part in the visit and who are currently in the audience this afternoon. So during this session, a number of things struck me, and I would like to briefly come back to some of them. First of all, there was the agreement underlined by almost all the speakers in this session of the huge burden of alcohol in Europe. In fact, whatever the metric used, alcohol is always very high in the burden of disease rankings at a European level or even worldwide. And this contrasts sharply with the very positive perceptions of alcohol in the public, skillfully nurtured by the marketing of alcohol products. But there is also an encouraging dynamic in Europe, as Florence Bertelletti showed, with the adoption of the WHO European Framework for Action on Alcohol at the committee meeting in Tel Aviv in 2022. And of course, the advances in labeling highlighted by Florence and very well illustrated by the Irish case. My warmest thanks to Sheila Gillini and Katie Dunphy for their very stimulating presentation. Their evocation of the minimum unit price strategy was also very inspiring, with major health benefits, with greatest reductions in deaths in people living in the most socio-economically deprived, and an excellent return on investment. And I would like to use this example to emphasize that, given the importance of the return on investment argument for advocacy and decision-making, Santé Publique France has decided to develop economic evaluations of prevention's intervention and the calculation of return on investment in support of its prevention's mission, in collaborations with team and experts in this field, and also by developing its own in-house expertise. I also noted that a minority of countries already have comprehensive alcohol plans at a national level, despite a growing body of data proving the effectiveness of certain measures in terms of both behavior and cost, as highlighted by Michele Cecchini. Michele also showed that it is possible to take into account the impact of the alcohol industry of measures considered to be restrictive for the industry, and thus make such measures more acceptable for policymakers and for the public opinion. This is difficult because the economic lobbies are very active, very organized, and very well endowed, as Mark Pettigrew and Miriam Savy showed so clearly. The study of the social determinants of health, to which Mark has made a major contribution, in particular with Sandro Galea, who is a member of our scientific advisory board, is a very important aspect of the implementation of a public health strategy for alcohol. In France, from 1991 to 2009, the Evalo provided a protective framework for young people's exposure to alcohol advertising in the media. Regulation in digital and on social networks is much more difficult to implement, as we have seen, than in the case of television. However, it's now on the web that the main challenges currently lie. Nevertheless, sometimes we do succeed, as our Irish colleagues have shown with the health warning on bottles that were adopted last May in Ireland. Other meaningful successes, the examples of the taxation of alcopops in France in 1996 and later on vinipops in 2019, presented by Miriam. These successes give us hope and show that we need to fight on different fronts, scientific, political, through powerful advocacy with stakeholders and by mobilizing civil society and the media. Such victories can also be seen as feet in the doors, even if, unfortunately, there are many doors. And this victory will contribute to the adoption of other measures. At Santé Publique France, we are particularly involved in the design and dissemination of national social marketing campaigns aimed at raising awareness of alcohol-related risks. Over and above their short-term effects on behavior, these campaigns help to advocate more restrictive measures, which then become more acceptable. This is the synergy and progressiveness of public policy measures. I want to take this opportunity to remind you that tomorrow afternoon, as part of the second day of the Santé Publique France meetings, Guillemette Quatremer will be presenting the evaluation of one of the last alcohol campaign run by Santé Publique France, which has shown the effectiveness of this campaign in France in terms of alcohol knowledge and consumption. So do not hesitate to take part in this session if you like to find out more on this evaluation. So to conclude, I'd like to return to this fundamental notion of complementary approaches. Health policies must include measures of different kinds, acting on the environment of individuals as well as addressing the individuals themselves. To build, defend, and implement these policies, it is essential to cross perspectives, discipline, and approaches. So in this sense, we were really fortunate to have such a panel of associations, economists, researchers, institutions, and representatives of learned societies. Thank you again for your very rich and complementary contribution. And I would also like to thank Michael Nassila for his excellent moderation, together with Viet, and also for the precious partnership we have with the French Alcohol Society, of which he is chairman. I thank you for your attention, and I wish you a very nice meeting here in the Beffroi of Montrouge.